Hello and welcome. I'm Dr. Drew Ramsey. So, you want to learn about how to be a nutritional psychiatrist. I'm one of the leaders in this new field, nutritional psychiatry, how we think about how to incorporate food into mental health and mental health treatments, and how everyone can do a better job taking care of their mental health by focusing on how to feed your brain and how to use nutrition to amplify and optimize your mental health. So let's talk about these two different pieces of knowledge that you need to really master if you're going to be a great nutritional psychiatrist. Now, lots of people can practice this. The first set of skills is really thinking about mental health. And you want to be a good mental health clinician. And there are lots of different ways to do that. You can go to medical school and become a psychiatrist like me. You can get a doctorate in psychology. You can get a master's in social work or a master's in mental health counseling. There are all kinds of different ways to be involved in people's mental health, along with being a school counselor or a member of a clergy or a church or a pastoral counseling center. So there are lots of different ways to learn about mental health. Let's talk a little bit about what those fundamental skills are. You want to be good at helping people understand what is going on in terms of their mental health. So that's a diagnosing and helping people understand their inner world and their set of symptoms. You want to have a good sense of treatment. Now, lots of us do different types of treatment, but it's important when you're in the mental health space to really know that there's a broad set of treatments for different mental health conditions. There's medications, there's different types of psychotherapies, and then there are other lifestyle treatments like nutrition that really can be helpful and beneficial to patients in so many different settings. So mental health is a set of skills, and the part that our team and I like to really emphasize is the importance of being an active and engaged clinician and getting a lot of experience in different mental health settings. So all of us have worked really all over in community mental health settings, in emergency rooms, in inpatient units, and outpatient settings. And then just the importance of working with patients and families and really just getting good at listening, at hearing how much each of us have our own really unique set of values and unique set of experiences when it comes to our mental health. So those skills absolutely fundamental to being in the space and to being a good nutritional psychiatrist. The other set of skills that you have to get is around nutrition, and specifically, how do you apply nutrition in a mental health setting? There's a whole world of individuals with lots of specialized training in nutrition. Dietitians, nutritionists, individuals who have a master's in nutrition and doctorates in nutrition. In the mental health setting, we're really looking at a specific idea in nutrition, which is how do we best nourish the brain, and then how do we help people have a joyful relationship with food and activate their motivation so they change their diet and change their food eating behaviors to best support their mental health and their brain health. So there are a few pieces of this that are really important. First, just having a stance in your own life as a clinician and as an individual about food, about your food values, about how you nourish yourself, about how this really works in your own life. Just like in mental health, kind of has always felt to me, you gotta walk the talk if you're going to be involved in this world and in helping people. Certainly, you need to know a lot about the new science of food and mental health. There's been so much data that's come out over the past 10 years. Some really just foundationally new principles for us, things like inflammation and the microbiome. I completed my medical school training in the year 2000. I completed my residency at Columbia in 2004. That's not what we talked about back then. So it's really exciting, all these new opportunities in terms of how we can approach mental health and brain health and how we can use these concepts to better take care of patients and better understand these illnesses. So how does nutrition get involved? Well, nutrition is absolutely fundamental to one of the newest and most exciting concepts, neuroplasticity, how our brain grows and changes. And proper nourishment and understanding where to find the most important nutrients for mental health, things like the omega-3 fats, iron, vitamin B12. This is a cornerstone of the knowledge base that you need in nutritional psychiatry. What are the nutrients? What foods you find them in? And then there's this part that I feel people who are in the mental health space are particularly good at. And this is, how do we activate behavioral change? How do we really explore within individuals what are their values around food? Our ability to understand the inner workings of an individual, what their motivations are, how things like culture and personal values really impact things like eating behavior and food choices. That's one of the aspects of nutritional psychiatry that I think is really important, our clinical stance, and how that really separates us in the food advice or wellness advice space. Our desire to really help people find a joyful existence with food that nourishes their brain, but really is achievable within the confines and parameters of their life. Those are some ideas around the skills that you need to practice nutritional psychiatry or to integrate nutrition into mental health work. The goal of this is to really help individuals eat with more nutrient density, eat with more joyfulness, and eat to support their mental health. I hope it helps you in your journey, that you hear first my encouragement. This is a really exciting field. There's so many of us that are starting to really think carefully about how do we integrate nutrition into mental health care in a responsible and effective way. And also that there's so many different ways for you to gain these skills, lots and lots of ways to gain experience on the mental health side of things, of how do we help patients with mental health concerns, and so many ways to gain the skills in nutrition, whether that's you learn more about preparing food as a chef or taking some cooking classes, whether you do some studying around nutrition or get a master's or an undergraduate degree in nutrition, whether you study dietetics or nutrition in school. These are all ways to get these two what seemed disparate knowledge sets that increasingly we're interweaving in the field of nutritional psychiatry. I'm Dr. Drew Ramsey. I hope you'll sign up for our Friday Feels newsletter. Please subscribe to this channel so you keep getting all these updates about nutritional psychiatry, and let me know what you think. I'll see you next time.